Hati Tzayanyi Sai Sazi Alison Irvine. Hello everyone, my name is Alison Irvine and today I'd like to talk to you about my practicum experience at Carrier-Sicani Family Services. So Carrier-Sicani Family Services, which I'm now going to refer to as CSFS, is a non-for-profit organization located in Prince George, BC, that has a governing authority from the Carrier and Sicani Tribal Council to provide comprehensive infrastructure for social health and legal services to 11 member nations between Prince George and Takla Lake. The really unique thing about CSFS is it has complete control over research. So all research being done is to identify gaps in service delivery, evaluate current services, and there's really an emphasis on always creating direct benefit to all these communities. My practicum was in the area of lung health, specifically rehabilitation and education. So I had the privilege of working on a 5-year mixed method research study that CSFS was doing in partnership with UBC called Strengthening Our Bodies, with the long-term goal of developing pulmonary telerehabilitation programs for individuals with chronic lung disease. So rehab programs virtually delivered to all these remote areas. To provide some context, First Nations peoples living in Canada do often carry an increased chronic respiratory disease burden, predominantly due to adverse childhood experiences, colonization, various social determinants of health, and lifestyle factors, specifically non-traditional tobacco smoking, so cigarette smoking. For my culminating project, I was asked to develop a project plan that addresses aim 1 of this 5-year study. And aim 1 is the qualitative portion, and it's simply to understand the values, barriers, and needs of physical activity in these communities. So what went into this project was a literature review on how the processes outlined in the original research proposal, so interviews, photo, voice, and focus groups, had been used together and in similar contexts, so rural Indigenous communities. And then I was a part of developing interview questions along with the research team, and it underwent a series of developmental phases until we came up with about 17 semi-structured interview questions all around values, barriers, and needs to physical activity. And then the last kind of thing that went into my project plan was coordinating data collection methods and data storage logistics with UBC to make sure that we're meeting ethical and confidential standards. So that was the project, but then the rest of my practicum, I actually had the privilege of implementing this research. So I'm going to tell you a little bit about the study process that we ended up following. So I did this research in 2 of the CSFS communities, Burns Lake and Wet'suwet'en, and we started by doing semi-structured one-on-one interviews, just asking participants basically what are their values, barriers, and needs to physical activity, and interviews ranged from about 14 minutes to an hour and 10 minutes. It was all dependent on how much information participants want to share. Then the next process that we did, we asked if they wanted to participate, was this process called Photo Voice, which is a qualitative arts-based approach that uses photos as a catalyst for further discussion, theme development, and contextualization. So what we asked was, after the interviews, we said, hey, why don't you go into your community, spend a week to 2 weeks, and take photos or find photos that you already had and that relate to your values, barriers, and needs of physical activity. So in some cases, participants built off what they discussed with me in interviews. Other cases, it was like totally new ideas that they hadn't brought up in interviews. So we came together for focus groups, and we asked participants to kind of go in a circle. So one participant would show their photo, explain why they took it, and then it was kind of, the floor was open for discussion, so others could comment on the photos, and you could really address and understand community similarities, but then also it was pretty obvious that there's a lot of differences too. And then I underwent a qualitative thematic analysis to find out kind of key themes from this research. So the study themes from these 2 communities. For values of physical activity, being able to maintain a long, happy, healthy life was number 1 across the board. Next was being able to do physical activity with family and friends. The third kind of key value that was really prominent in this research was being able to get back on the territory and do traditional activities. So 9 out of 10 participants I interviewed mentioned berry picking, and birch bark harvesting was also very, very prevalent. And then the last common value was the socialization component that physical activity can provide. So not only being held accountable to getting regular physical activity when you're meeting up with people, but also kind of like the support network and stress relief that doing physical activity with other people can foster. For barriers, both of these communities identified the lack of a clean, safe space to do exercise inside. These communities are located in northern BC, so they face persistently cold temperatures, lots of snow and ice for many months of the year, and they don't have a place to do exercise inside. Another barrier was so then the environmental barriers, which I guess I kind of just mentioned. The other environmental barrier besides the snow and the cold temperatures is forest fires and the smoke. They had a lot of smoke this summer, and it's especially an issue for individuals with lung health problems. And then the last barrier kind of mentioned by most participants was time. So family obligations, taking care of older family members, but also children, and then not having enough hours in a day when you work 9 to 10 hours a week, in the day, and then you don't really want to go and do physical activity. Then we asked some kind of future program feasibility questions. Basically, what does CSFS need to provide in order for you to want to participate in these programs regularly? And these communities identified a few things. One was that whoever is running the programs, whether it is virtual or in person, this person needs to be consistent, and also they need to be considerate of the surroundings in which they're working. The next is that programs need to be flexible in when they're offered, but also individualistic in being able to cater to like a range of physical and mental abilities. And the last thing that these two communities identified as important for future exercise programs is a holistic approach. So when I interviewed participants and asked, like, what does physical activity mean to you? Oftentimes incorporated in the answer was food and traditional language, and so incorporating these into future exercise programs is important. So my final deliverable for CSFS was to write a report on this research that I did and recommendations and observations that I made, because this portion of the study is going to be implemented in the 9 other communities. So I kind of made some minor recommendations on how I would change participant recruitment, data collection, and then I also kind of emphasized that for this portion of the study, we didn't ask participants how best to promote future programs and disseminate the educational tools that are going to be created in the long term. And then I had 2 observations that I kind of wanted to emphasize in my report. One was the importance of researcher-participant relationship and relationship building and trust building in general. And this was talked about a lot yesterday with Charlotte, and I felt like I needed to emphasize it because I had firsthand experience. Every time I went back into community, I was like, participants were more open with me, I was more relaxed, and the process was just easier when a relationship is established. The other really cool observation was that from this research, just engaging in the research processes, there was like a huge motivational component generated, and participants were like more motivated to get physical activity. One of my participants was like, I bought a Fitbit, I'm investing in my health. And so I kind of said to CSFS, like, look, let's see if we can address some of these barriers now instead of waiting 5 years for this study to be done, and build off of the motivation that some of these participants are experiencing. Strengths and challenges of my practicum. So working in this research study, the ethics, funding, purpose, and procedures were all laid out for me and approved by CSFS Advisory Committee, which makes up, it's made up of 2 members from each of the communities. And then I got to do research on my practicum, which I feel very fortunate about, and in an area of interest. And then I had exposure to various components of health research, which was also interesting. The main challenge was it was very difficult to develop a timeline and work within practicum requirements while trying to promote community-led research processes. Public health implications. So what this study is really trying to do is to understand community-specific resources and values and incorporate Indigenous health knowledge so that culturally relevant information is created in these exercise programs and educational tools to better promote lung health. A lot of times service delivery models don't take into account values and community-specific resources, so that's really what this study is trying to do. And acknowledgements. I would like to thank the Carrion County peoples whose privilege I had to do my practicum on their territory and this research. Harris County Family Services, my supervisor, Dr. Travis Hollick, who may or may not be watching, and my cultural liaison, Benna Rathburn, the community participants from Burns Lake and Wet'suwet'en who shared their stories and perspectives with me, Dr. Pat Camp, who's the primary investigator on the 5-year study, and the research coordinator, Barbara Carlin from UBC, and all my MPH professors and staff who've been encouraging and supportive throughout this process, and all my family in the middle row there. Yeah, thank you.
So any question? Oh, good.
Of course you do.
Let me see, I don't know which hand went up first.
How dare you? Great presentation.
What did I not make clear enough?
You did a wonderful job. It was a great presentation. I have a question about facilitating the relationship building and the trust, building that trust. So what kind of tools and what kind of opportunities did you see as being like important for building those relationships with the people that you're going to be interviewing and, used throughout the process? Or I guess used is not the right word. You know what I mean? You know what I mean? Okay, cool.
Yeah, it's a bit of a unique situation because CSFS has been given authority and kind of the privilege to do research in these communities, and they have a 25-plus year relationship with these communities. So even having kind of like the CSFS sticker with you already kind of breaks down a little bit of the barriers. What I ended up doing, so I had a cultural liaison who knows absolutely everyone. You'll walk into these communities and she will know everyone by name and she'll kind of introduce you, and it's already a little bit more friendly than kind of like a formal introduction. What I did was I just made community visits outside of research time. So I just wanted to make myself known in the community, and I wanted to just like check in with people and let them know that I care about them on an individual level. I'm not always here to ask something of you or take something from you or take your time. Yeah, so that's kind of what I did. And I noticed a huge difference. Like one participant, like I sat down with her and I did her interview, and like she provided all the examples, but then when I saw her again, she was kind of like joking with me, and then I saw her again and she gave me a hug, and so it was like every time I would see her and I was like a more familiar place in the communities, it kind of just, it's a little bit easier to build relationships.
Hello, hi. Great presentation, super interesting to see some of the stuff we've been learning in school actually at work and in progress. There was a couple topics I was curious if you could expand on them. One of them was your suggestions to make modifications to recruitment and data collection. I'm curious what the recommendations were, like what would make it an even better practice. And the second question was that it was difficult to develop a timeline and work within practicum requirements during community-led research processes. And I'm wondering sort of what were the obstacles there?
Okay, so for the first question, around recruitment in consultation, so this UBC and CSFS started to consult with communities in 2016 on this project, and communities identified they wanted this project to kind of be open to outside of lung health. So the criteria, I probably should have mentioned that, the criteria to participate in the study, you had to be 30 years or older and have some sort of chronic disease. And so I kind of just highlighted in my final report, like we had 5 participants in each community, and only one had some sort of chronic lung disease, and then the rest had diabetes as their chronic disease, so not having kind of a cross-section. So my recommendation was to kind of go slower in kind of participant recruitment to try and get a cross-section of chronic diseases, but I also emphasized getting a variety of ages, because I noticed in one community I got to interview an elder, and in another community I got to interview an older person, and their perspectives that they shared were a lot different, and I found they were really interesting and valuable, and I think it'd be beneficial to really understand the values, barriers, and needs of these communities if you can kind of get a larger sample. And your second question, so are you a BA student or MPH student? So for your MPH, throughout kind of the 4 months on your practicum, you have like these various tasks you need to complete, and I found it really challenging my culminating project was a project plan, but I wanted to do this research, so I had to make sure that I had enough time to do it within the 4 months, and I had to have certain things done at various checkpoints for school. But it was really difficult for me to write down on paper, for example, the photo voice process. Who am I to say, you only have 2 weeks to go to take photos? What if you want a month? So that was kind of difficult. It ended up all working out for me. Like, communities were able to kind of collect whatever they wanted to in the time frame that worked also for my schedule. But it couldn't have been, it not necessarily would have worked out like that. So I really struggled with that, though, like writing a project plan with a timeline. Yeah. Yeah.
Good. Well, thank you very much, Alison.